be have the time, say like 3 or 4 months, the patient experience that they have the flashback, they have something, whenever they close their eye, something just hit them back on. There's some prescription drugs that using for this particular symptom or disease. The most common one that they're using is Prozac or fluoxetine in generic name. There are also some other Zoloft, other type. Unfortunately, being a pharmacist and in this medical field, we realize the success of this kind of drugs is not really promising. But yes, they do have some degree helping the patient, but they're not 100% total successful. We always do. What we'll say, like if a patient have feeling certain type of drugs or they have certain type of disease, okay, we will have a printout for them to state, okay, this is the printout. Please, if you have time, read it. If you don't, come back or whatever, one more time, we will discussing this directly.
Well, back in 2011, I had the unfortunate experience of witnessing my late sister in a body bag. She passed away at the young age of 32, and it was unexpected, but we saw it coming. But I still remember that day as if it was yesterday, and so that was on Canada Day in 2011. I became very suicidal. I contemplated suicide because I wanted to be with my sister. I was depressed. I was already going through a rough time in my life at that time, and so when this happened, it really escalated everything. And so for that week, I was definitely contemplating suicide. Luckily, I was talked out of it, and I never got to the point of actually, attempting to it, but the thoughts were definitely there. And I took probably a few days off, and I was working out on the tarmac at the time. When I made the decision to come back later on that week, I didn't feel comfortable in going out and working with the planes, so I asked to be placed in the bag room, actually the WestJet bag room, and because I felt like I needed to be constantly working and doing something, because working out on the tarmac, you have a lot of time to yourself in between flights, and I needed something to keep my mind off of what was happening. Well, I mean, at the time that it happened, when I let them know what happened, they were nothing but supportive and comforting to me, and they told me that I could take as much time off as I needed, that they didn't force me back sooner than I needed to be, and so I was very appreciative to that. But on top of that, there wasn't really anything else as for, counseling or, any helpline, there wasn't any of that. So, went through therapy throughout my whole childhood, off and on, but they were always bad experiences I found in the end, and I didn't feel as though they helped me. And so, because of my history with seeking professional help, I didn't want to go down that road. I mean, the worst thing you can do is try to cover it up with makeup, or throw it underneath the rug, I dealt with my situation in a way that I felt was best for me. No two situations are alike, and so for some people, professional help is the way to go. For others, it's medication. You know, but for me, I thought, you know, the best way I could deal with the whole situation was surrounding myself with my family and friends and leaning on them for comfort